Yeah, that's just one of the things that we like to do. Like I said, we driving foods in communities with better health. You know, kids are walking, go give them some fruit. Apples and oranges that are full of nutrients, several benefits versus me going inside and getting them some candy. We're driving foods in communities with better health, so that's definitely the motto. As long as we're able to actively reach people in these depths, because right now it's easier for the kids to go buy candy or their parents to go buy sodas versus them getting an apple or orange. That's a hard act. You'll never see anybody walking around eating produce because it's not readily available. They don't have the access, but we're here for them.
Welcome to the 1334 podcast. Today's episode is an archived episode. This is the first documentary that 1334 and the Pivot Foundation put together for Albany, Georgia. This is a Better Way Grocers solution to food deserts in Albany, Georgia. Albany has a problem you have never thought of.
It feels good to know that someone saw a problem and came with a solution and decided to put that solution in a place where people actually needed it.
Where you live matters more than you think.
Yeah, took the transit bus to Walmart, and had to get someone to help unload it off the bus, and and not to mention when I would have to come back, I would have to wait sometimes over an hour for the bus to come back and get me. So this means a lot.
There are thousands of people in our city who aren't able to get the simple, healthy groceries they need.
The health risk of not having a proper diet include stroke, diabetes or worsening diabetes, heart attacks, high blood pressure, high cholesterol.
Food deserts are areas where residents' access to affordable, healthy food options are restricted or non-existent due to the absence of grocery stores within a convenient traveling distance. Because of this, many people suffer from higher rates of obesity, type 2 diabetes, cardiovascular disease, and other diet-related conditions. On screen, I have a food desert map for Albany, Georgia.
Oh yeah, today what we have honeydew melon, we have mangoes, yellow mangoes, bananas, oranges, lemon, limes. We have bad greens, collards. We have red seedless grapes, green seedless grapes, tomatoes, peaches, cucumbers, squash, carrots. We even have a stir-fry mix. I know I mentioned tomatoes also. We have sugar snap peas, bananas, ginger, apples, oranges, sweet potatoes, the traditional sweet potato. We have white sweet potatoes also.
It means a lot to me because I don't have to worry about trying to get out to the supermarket, because being in a power wheelchair is kind of rough, But before this mobile grocery bus came along, I had to do it.
I love what I do. Yes, it's very rewarding. Like I say, the great thing about it is I grew up in a food desert. The closest store to us was over 20 miles away, one way. So, being able to be a solution to a modern day food desert in the actual city area, it's always definitely rewarding. Sometimes the smiles that I get, the thanks. I've had people to get on the bus and pray for us, pray for our success. Sometimes we go to some of these other communities where the kids will come up and ask for snacks, and I just give them a healthy snack alternative. I give them an apple or orange, and they're just happy to have those. So, being able to try to change some people's eating habits, and also being able to provide people with access to food is probably one of the most rewarding businesses that I've been in.
Most people that have children want to be here for their children. They don't want to shorten their life because of a health condition. You know, everybody wants to live. I haven't met a person yet that doesn't want to live. And so it's not an issue of not wanting to, it's an issue to me of proper education and taking time with people to really understand and help them understand the risks of not doing things the right way.
This is another thing I do. I also, when I see the kids, I try to give them some snacks, some healthy snacks. So I think it's like 5 of them. So I let them choose out what they want, the apples or the oranges, if they're to stay around long enough. Where you? Come here, little man. You like apples and oranges? You want an apple too? Hey, what's going on? How you doing? Where you been at? Huh? Yeah, I remember you. I remember your face. Where I remember you from?
You had came back home.
Okay.
And you come to my school.
Oh. Dennis home. How you been doing?
Good.
Okay. Yeah, I remember your face also.
Oh, mama.
Yeah, I remember your face. Remember I used to come over there and see y'all when I was counseling. Okay. All right, hey, I hope you like your apple now. Yeah, that's just one of the things that we like to do. Like I said, we driving foods and communities for better health. You know, kids are walking, go give them some fruit. Apples and oranges that are full of nutrients, several benefits versus me going inside and getting them some candy. We're driving foods and communities for better health, so that's definitely the motto. As long as we're able to actively reach people in these deserts, because right now it's easier for the kids to go buy candy or their parents to go buy sodas versus them getting an apple or orange. That's a hard act. You'll never see anybody walking around eating produce because it's not readily available. They don't have the access, but we're here for them.
Because I'm a diabetic and I have to try to eat right. And I find this bus have a lot of nutritious stuff that I need to eat, you know, especially the vegetables and, you know, the fresh meat and the fruit. They have fresh fruit. It's helped me to realize that there are a lot of people that are in my situation that would benefit from this.
That's what you see in the food desert. Fast food, dollar stores. We have one grocery store for basically almost 1/3 of the city, you know, and that's just a situation that pretty much creates a health crisis, and that's what we're trying to make the connections and get people to see, and also policymakers to see, so we can do the things we need to do to change it.
The nearest grocery store from here it would be Harvest Supermarket, and that's on Radom Springs. From my location, that's almost 2 miles. And in this area, almost over 80% of the residents in this area don't have transportation. You know, just being able to provide access and being able to give them the fresh produce that they want. We do this 6 to 7 days a week. And we've been doing this. We started research about, 2 years ago? We've been actively on the ground since we've been actively involved since September. So we were doing this before COVID was even a thing.
I have family in the area, and I always have to call one of my sisters or my dad that lives a couple cities over in Camilla to take me to the grocery store. And you know, when you do that, you have to work on someone else's schedule, and you know, you have to see when they're available, how much time they have available. Do I have the money to go now? It means a lot to me because someone knows that we are in need, especially in this area. There are no grocery stores in this area, absolutely none. And they're closing more and more all over the city. It's nice to know that you have another option to go to. And even in cities like, I saw that the bus was in Newton recently. It's important that people have a place to go where they can buy fruits and vegetables and meat and other, dry goods from a person that they trust.
Once you find out somebody else's perspective on a certain situation, you kind of understand them as individuals. And again, I think that's good for a healthy community. And it also tells people that, okay, I care about your situation, even though I may not live your situation, even though I may not live on your side of town, but I care about your situation and I want to see you do better. We're unifying. We're unifying around a problem that we know we have, and that so many people are engaged and really moving toward a solution, and finding solutions to a problem is always very good.
There's no better feeling than to serve people. I do have a job. I've been in the financial industry for over 13 years because I'm still working. And the feeling that I get from working in banking versus the feeling that I get when I'm serving people, it's a complete different feeling. So I have the feeling to serve. What we do, we have very small margins, and those margins go to keep fuel in the generator and keep diesel in the bus. We don't charge a delivery fee. We go from one corner to the other. We go to other, different cities, and we don't charge anybody anything as far as a delivery fee. So there's just no better feeling than to be able to serve the community. My goal actually is a part of our mission, better health. It's a simple solution. People of different colors, low income, they don't have the access. And once people can understand that a small change in the way they eat can have better health outcomes, I think that would be goal, mission accomplished. I would love to just hear people, after they come from the doctor and say, hey, my blood pressure's down. I'm off of this blood pressure medicine. Hey, I'm not having to take. I'm one more, and I'm coming off of insulin. That's the goal.
And when I can physically show that to a patient, and I have kept them out of the hospital, I have kept them from having a stroke or heart attack. I have kept them from becoming diabetic if they're pre-diabetic. I've kept their blood pressure down. When I can physically show that to them on paper, that's all the motivation they need. So then they're going to want to keep going. And that's really what this is about, is changing behavior. But you got to have access to the proper tools to do that, to be successful. So if we think about Maslow's hierarchy of needs, and we think about that basic level of need that motivates people to want more and to do more, it consists of, food and water and, just the basic things. So ensuring that people have those basic needs met, I think leads to not only a healthier life, but a happier life.
I don't get to do it enough. But it's coming. So, that's the part that, we're hoping that we can get, where we are getting a lot of support from different organizations. We have partnered with an organization out of Atlanta, Wholesome Wave, Georgia. They're joining us in this fight. So for every purchase that a SNAP participant makes for fresh fruit and vegetables, Georgia grown fresh fruit and vegetables, we'll match their dollars for $25. So if they spend $25, they'll get $50 in fresh produce. You can help us today by going to donate at www.abetterwaygrocers.com.